The CECC has also restricted PCR testing to people with COVID symptoms or a positive rapid test. The new policy is aimed at reducing the burden on hospitals, which have been flooded with people seeking PCR tests. On social media, one user claiming to be a nurse said her hospital was struggling to keep up with the workload and that her colleagues were getting infected one after another.
Outside the ER, rows of people wait for a PCR test. Inside, medical staff rush to attend to the crowd. On the internet, reports are swirling that the healthcare system is under strain. One internet user who claimed to be a nurse said that her hospital colleagues were getting infected one after another. She says that ambulances were bringing patients over so quickly that at one point there were only 2 nurses for every 50 patients.
There
is no need for such a situation. If you don't have symptoms, do not go to the ER. It puts a lot of pressure on medical staff. There are people coming to the ER with no symptoms or only mild symptoms. You should only come if you have symptoms. For example, if you have a chronic condition or a severe fever, breathing difficulties, and so on. These are the patients that should come to the ER. We should try to leave ER capacity for patients with severe symptoms.
Doctors and nurses appeal to the public to not waste medical resources. With non-emergency patients flooding ERs and putting pressure on the health system, Health Minister Chen announced 5 countermeasures on Monday.
Do not rush to the ER. Go to emergency testing stations set up by local governments and get tested there instead. Hospitals with emergency clinics should set up specialized clinics for COVID and for patients with fevers. These clinics are for patients with mild symptoms or no symptoms at all who have tested positive on an at-home antigen test. They can be assessed for testing and provided with medical attention. People with no COVID symptoms must show a positive antigen test in order to get a PCR test. Home isolation or home quarantine will be dealt with as per previous regulations. We would also like to encourage local clinics to provide testing services. Hospitals should launch contingency mechanisms to limit capacity and deploy manpower to assist with testing, reporting, and managing patient beds.
With local cases going up, the medical system is feeling the strain, especially at emergency clinics.